Hello, my name is Cora Appelbe and you're welcome to Inclusion Health podcast series. This is part of a continuum of the Including Inclusion Health Voices from the Margins webinar series. Today I'm joined by Michelle McDermott, Endoscopy Triage CNM2, University Hospital Roscommon, and Christine Rohan, Patient Advocacy and Liaison Service Coordinator. You're both very welcome. Delighted to have you.
Thank you, Cora.
So I'm going to just jump straight in to the discussion. So how did the RUH Rainbow Project come about?
Thanks, Cora, and you're welcome to visit us here in Roscommon. The RUH Rainbow Project started as a clinical inquiry. In my role as endoscopy triage CNM2, I received a referral from a GP requesting an endoscopy investigation on a patient that required a scope to be carried out. There was limiting information on the referral for me, but when I went through my regular process of the triage process, I noted that the patient had been registered previously in a different gender. What that caused for me to do was to just investigate further in relation to the transitioning process for the patient. What I really wanted to know was there any clinical guidelines in relation to the change of gender on a referral, how the patient would be admitted to the system here from a hospital policy perspective, and also to be able to facilitate and create a safe passage of care for this patient, that the right patient would be treated at the right time and in the right package of care that's necessary for them. So with that, I looked to see what I had available for myself, and then I came to our patient advisory and liaison service officer, which was Christine, just to ask really the general clinical question to see was there any other advice and guidance that she would have from her clinical experience to be able to navigate for me to see where I could answer the clinical question. So from then on in, Christine and I met up, and we had several meetings at that time.
Thanks, Michelle. I'd just like to make note that I'd only started in Roscommon 3 weeks before Michelle knocked on my door, but it was a great collaboration and we've done an awful lot of work together since then. So when we kind of came together, Michelle came with the question, have you any guidelines? Do you know anything? Was there anything in your previous role? And what are your thoughts? So we have worked together over the last 18 months to create this project, and it's really still only in its infancy. We have a long way to go and there's an awful lot more work to do. But what we did do is we did an extensive research phase. So we went through international policy, national policies, we spoke to colleagues, we went through our different forums. So Michelle is in an endoscopy triage forum, I have a PALS group, and we asked all the questions that, did anyone have any experience maybe around the country? And with all the research that we came up with, the answer was no. It really showed that there really was no national guideline as to how to make your healthcare environment safe, effective, open and non-judgmental. But at that stage, I suppose, we had a couple of meetings over the research. We went to our director of nursing. And from there, we went, we have a patient, this is what we've come up with. And we went with a quality improvement project proposal to the director of nursing. And from day one, great support to the project and has given any guidance and inspiration or support that we need. So we'd like to thank Ursula today on the podcast as well. From, I suppose, the research phase then, it was like, how do you put it from paper to practice? Again, this is new, where the culture, the environment, it's a healthcare facility and everybody is trying to provide the best care they can. But maybe, we felt that education and training was maybe where there was a gap in this area. And from there then we walked around to each department trying to kind of gather maybe some feedback from staff as to where the culture, where everything was at and where we could go.
So how did you do that?
So we did that by participating. First off, we kind of tried to garner the support. So interestingly enough, that I had just come into my own role as a CNM2 and endoscopy triage a few weeks before Christine started. So like Christine, I was still a new face to the role, and we found that it would have been interesting to objectively visit each department to see, was there an identifiable need within that department? Could they pinpoint or could they signpost to us areas that they felt was lacking in relation to gender diversity and inclusion training? was there any kind of key elements that they could pinpoint from their specific speciality that we could help us create a programme that would help direct our staff, provide education for the staff, and then also in turn would create a very open environment for our visitors and patient attendees. So we set about creating the bones of what we formed the RUH Rainbow Education Session. And what we found very important from that was that we had feedback from the LGBT Ireland Champions programme that we felt was a great basis as an education and training programme to help structure us in the formal structure of what we had created. What we found from our initial stages was that there was a general accepted need to provide education awareness, particularly in relation to pronouns and terminology, basically providing an on-the-ground forum where we could discuss basic do's and don'ts when it comes to understanding language and having sensitive discussions, particularly when it does come to transgender care. It is a very topical conversation at the moment, and rightly so, because society has changed so much. We need to be able to address when these issues do arise within the form of accessing healthcare. So without having a platform, we had to start somewhere. So during our research phase, we were very, very well supported in our endeavours, and where we collaborated and accessed information, where we've had interactions with the National Gender Service, we've had interactions with the Rainbow Badge Programme and specifically Lindara and Cherry Orchard Mental Health Services, as well as the LGBT Ireland Champions Network and services there. In turn, we found the information that we retrieved, we were able to create a structured approach, a structured programme that would be able to provide education and training on these specific levels, and it would allow our staff to be able to be inclusive. And what we found really from looking at stuff nationally in Ireland, that it was very important to us here that we would open a programme that would include all members of staff within our hospital community, and not that we would create a programme that would be just driven from a clinical perspective, that we would recognise that everybody has different ways of learning and interpreting information. Not everybody is on the same wavelength, that you're not trying to push an agenda, but you're really trying to look after the patient 100% of the time, and that in turn looks after the staff as well as the visitors that are part of our environment. So we try to create a community atmosphere that it is safe and welcoming, but at all times within policies and procedures that's safe for the patient and for all our staff. So when we created our programme, it did involve continuous research, continuous access to our resources and our partnership across all spectrums.
So from there, really, we had kind of touched base with staff with our walk-arounds, but the next step was kind of bringing the project and more information to staff. As Michelle said, we want to create a community feel, and to do that, I think we need a little bit more interaction, and it is Michelle and myself, so there's two people, but we need other people, we need more staff, we need more engagement, and to do that we held some information stands. So in the main thoroughfare of the hospital, we ran 5 information stands over different days in February 2023. We had different topics every day. So we looked at the progress flag and its meaning, we looked at pronouns and terminology, we looked at support services around the country, and also kind of policy, either national, international, what's available, and then there was a day kind of based on media and what's kind of topical. And that really started a conversation within the hospital, and kind of that, again, back to the community side of things. You know, people would stop by and they're like, oh, what's on today, or what's there? And the one that really stood out to me was the support services. So we had printed out a large map of Ireland, and we put a pin in every area. There was a support section or a support service for people in LGBT and trying to access healthcare as well. And what we found was that people were like, oh God, we never realised that there was as many supports outside of Dublin. So I think the visual impact of maybe an information stand and what we were providing in the information stand gave people maybe some awareness and understanding of the topic. So then roll on into March 2023 and we started our education sessions. So as Michelle alluded to, we wanted to make sure that our education and training was open to any member of staff. It didn't matter where you worked or what department or what your title was, you were invited and more than welcome to participate. This is a non-mandated training. So we were very kind of clear from the start with our quality improvement proposal, with our agreement from management, was that it wouldn't be mandated. And that has worked well for us, we feel anyway, here. So to date, what are we now? We're in July 2024, and we have over 15% of our overall staff population have attended an education and training session. So it doesn't necessarily have to be a mandated programme. Michelle has gone through kind of what we cover, but it is basically pronouns and terminology. It's from the feedback of people on the ground who are doing the day-to-day work. What do they want to know, and how can we provide that information? And the education sessions, they're about 40 minutes. They're interactive. We give a small we give the 40-minute presentation, but we give time for questions. And that's really where a lot of the interaction comes from then when people do attend our education sessions, because they could be like, well, what if this happened, or what if that happened, or how would we overcome that, or what are we doing about this? So it also helps us improve the project. We've said this from the start, we want to build a solid foundation. And to do that, I think the education and training is one part, but it's continuously improving and trying to ensure that our hospital is open, inclusive and non-judgmental for patients, staff and visitors. It's all part of that. And I think from the staff perspective, Michelle and myself have both joined the HSE HR Reach Out Network, which is a network to support LGBT plus persons who work in the HSE and their allies. So we have meetings maybe every 3 to 4 months. It's a national forum. Any person of the community or allies can join, and it's great support for the project because we come from a place of allyship with this project. But it's very important to be able to hear the lived experiences of patients and staff and visitors who come to the hospital and for other services, so that we know what's happening around the country. Maybe that can help to improve our project, or we can share some of our knowledge with other people. We are certainly not experts in this area. We're just here to try to facilitate some more awareness and some education within the hospital.
Yeah, I agree with what you're saying there, because without support and the guidance that we've received guidance from LGBT Ireland and as champions, we've received support and encouragement from our senior management here, our Director of Nursing, our General Manager here, and also from the REO services led from Galway. We've received wonderful inspiration as well, also from listening and learning from our actual patients, our visitors and our staff, and also from our external colleagues that have heard us present our project on a different forum. But most of all is that when we move forward, that we demonstrate and we provide an area that we will be open to listening to how we can change and move forward with everybody into the future as safely as possible. Like without creating a structured environment, you had to start somewhere. And although it sounds very formal, it's very important that you have to start with a structured approach, because if we didn't have a structured approach to our project and to our education sessions, we really wouldn't know where to navigate or where to move to next. We need to model some of the shared values that other organisations have started, other projects that are currently in existence, and also what is happening with our government and legislation. We have to try and implement that and adapt it to how it is appropriate to our community here. We're very conscious of how people understand the information that we're trying to provide, or that we're trying to give examples of, like in our information stand. We're very conscious that not everybody can sit down and read a pamphlet that's 10 pages long. So sometimes visual representation on an information stand is actually more beneficial than actually putting documents for everybody to read. So, we have to be conscious and review what we present on a regular basis, and that's what Christine and I do. We meet, we adapt, and like what Christine has said before, our patient and understanding the lived experience of somebody that has access to healthcare is the basis of where we will be able to change and move forward, and to understand, well, what we did good, unfortunately what happened, or what we did bad, and to learn where both of us don't understand, to find out more. And that's the key really to moving forward with our project, and why we've been able to, I suppose, provide leadership for some of our staff here, and to be able to move forward with the project goals.
You showed me earlier some packs that you give to staff who've completed it. So it's quite a comprehensive process. It's not just about delivering the talk and then you're letting them off. Can you tell me a bit more about the packs and what's involved in those?
Yes, so as you say, it is quite comprehensive, and I think sometimes we both feel we're a little bit strict on this, but we feel again, for strong foundations for this project, we need this process. So staff are invited to attend an education session, but they're not given their badge that day. They then have to complete a HSC land module, so it's LGBT plus inclusion, the basics, and also sign a declaration. So this is probably the most important part before you ever get your badge. And the declaration really is that you're signing that by wearing your badge, it's a responsibility. You're there to listen, you're there to support, and you're there to signpost somebody who comes to speak to you, whether that's a staff member, a patient, or a visitor. We're not expecting people to be experts, but to know where to go. Where do I signpost? Who do I ask a question to? If I don't know the answer, where do I go? So kind of to support that as well, when you get your HSE land badge or your HSE badge with us, we give you a resource pack, and that covers supports around the country, local support groups, and also some information about policies and procedures. So that comes back to our research phase. The information that we had kind of found from our research phase and we found was very important and relevant to every staff member is within the resource pack with QR codes, so you can go and read them in your own time. And then some information about pronouns and terminology and gender expression and things like that. So that's what staff can bring away with them with their badge.
And what our visitors and what our remaining staff that haven't undergone the rainbow training is that we have a small A5 sized little poster that's on display in patient facing areas, and it's basically just drawing the attention to say, have you noticed our rainbow badges? And the reason being is that it just tells the visitor on the sign that staff wearing this rainbow badge aim to promote an open, non-judgmental and inclusive environment for people that identify as LGBTI. And what the rainbow badge means is that you can talk to me freely. I will do my best to get support for you if you need it, and that this is a place of inclusion and that you are not alone. So we find that it also provides that other sign for those that may not have undertaken the training, but to know that there is actually people that are visible across the hospital environment that can actually signpost if there is an issue, can actually sit and talk with you if you have an issue. And that we also have created a generic email that's called rainbow.ruh@hsc.ie should anybody want to contribute like a feedback, or if they have a query, or if it is that they've got a concern that they'd like to talk or they'd like to meet with the project leads, we're able to facilitate that. So what we try to do is that we try to ensure that everybody feels safe and comfortable to address these issues.
It's fantastic, honestly. I know you've a number of awards that you've won for this project, and congratulations on those. Do you want to just tell us a couple of pieces about that?
Well, thanks very much, Cora. Christy and I are absolutely over the moon, I suppose. We're honoured more than anything else, and we're doing it because it is just, it's formal recognition of the work that we've actually committed. And we've participated in this project, Christine and I, the two soldiers, I suppose, from the very, very beginning, and it has required additional work outside our respective roles. So the project itself is huge. The volume of work is massive. However, it's with the ability to provide and with the overall goal that we would provide a safe healthcare here in RUH for everybody. But our awards really have come as formal recognition of the work that we've committed, and we know that we have created something that is warranted, is merited, and does really recognise that we're moving with the times. So our first approach to getting formal recognition was that we received a commended citation certificate from the HSC Health Excellence Awards Committee, and that was from October 2023. So we attended a presentation event in Dr. Stephen's Hospital in Dublin, where we met with the selection committee and we presented the project and our findings to date. Because the project was so new, it is a huge accolade to have received a commended citation in such a short period of time. So gathering on the back of that with a little bit of inspiration and drive, just from saying, okay, well, maybe we can just look a little bit further. Unfortunately, there's no formal recognition process within the HSC, or apart from the HSC within the public sector hospitals, that we went to the private sector and we entered the Irish Healthcare Centre Awards, and where we have received the overall category winner for the Equality, Diversity and Inclusion sector. Basically, the important part of that was that it was also a formal recognition that when you demonstrate your work on such a public forum that you have your work objectively analysed and assessed to say that, well, there is credence and merit in what you recognise and what is necessary. And we have been finalists in the Workplace Excellence Awards for 2024, as well in the Inclusion, Diversity and Equality sector. Unfortunately, that's a corporate domain, but it's still great to get yourself out there, to represent your organisation, to represent your work, and to represent the population on which you're actually targeting. So we're very, very honoured and privileged, and we hope that our journey with the Rainbow Project continues well into the future, and we've started the foundations of a project that can actually be a proper, safe and structured movement within healthcare and education, really.
Well done. I suppose before we close, I just want to ask, is there any key messages that you want to share with us going forward for other services that might want to look at doing something similar for their hospital or community?
I think Michelle and I both have a genuine interest in this project, and I think that really does help. We can bounce ideas off each other and come and, we can come and think about something and see how we can develop it further. But it's really important, to continuously improve. The project is only as good as the work that goes into it and the feedback that we receive. So whether that's feedback from staff, so we have conducted different staff surveys to get their feedback where we can improve, but also to get feedback from our visitors and patients. There is always room for improvement in anything you do, and we're very cognizant of that. And we're only, as Michelle said, learning and starting the foundations of this project. So where we would really like to go in the future would be to have a very open and inclusive hospital and healthcare facility that can provide safe and effective care, but also to create a working group with our colleagues back to that community approach, that we can come together, we can work on policies, procedures, we can troubleshoot if something happens, or can we try and preempt things before they happen, and how can we make and put processes in place that we're providing the most effective care possible.
When we created the Rainbow, what we wanted our staff to understand was that the Rainbow just doesn't reflect colourful lanyards or colourful symbols. It actually has a full meaning for us. So the R in our Rainbow stands for respect and responsibility, because as clinical professionals, we have a clinical code of conduct as well as a code of ethics. And the core values of those codes is the respect for their person as a unique individual and respect for their right to self-determination. And as healthcare professionals, we have a collective responsibility to acknowledge and address any lack of education or awareness of gender minority issues. We also have a collective responsibility to listen and learn from the lived experience of our staff and their service users to deliver healthcare on real world issues, and that's very, very important for our patient cohort. And we also have a collective responsibility to be proactive and preemptive, like what Christine has said, on issues that can arise during the course of our work as healthcare practitioners. And by doing this, it allows us to embrace new ways of thinking and delivering care. It also is in a way that meets the needs of those persons who might typically be excluded. The A in our Rainbow stands for allyship, and that means that we provide visibility and a voice for persons who traditionally may have felt excluded or marginalised. For us, the Rainbow Project is driven and enriched by allyship. As allies to the RUH Rainbow Project, we consciously raise awareness of issues impacting the minority groups through our education sessions and information stands. We build capacity by assisting in the development and review of strategies currently in place in order to combat any poor health record management. We assist in behaviour change, and that's by recognising the impact of attitudes and behaviours of staff within the organisation, and that's by respecting, understanding and highlighting the generational divide that exists within our health system. We're in a fortunate position where we can we're dealing with 4 generations effectively within the healthcare system, and that must be acknowledged, because just not the one message will sit evenly with everybody. The I in our Rainbow stands for inclusion, and that is creating and navigating an inclusive healthcare environment. And that's really where we stand, and that's where we hope to go into the future. And it's something that just doesn't happen overnight. Inclusive healthcare requires an action plan that focuses on various determinants that directly impact on the access and delivery of our healthcare services. The goal of any environment is to recognise how people can understand and learn, and how that we can approach those learning difficulties, and we can recognise certain intersectional factors that they'll assist us in creating an educational programme that facilitates the delivery of an integrated and accessible healthcare for all. And the N in our rainbow stands for normalising, and that's normalising the conversation about LGBTQI issues and health inequalities, and it allows for a shared belief that it's safe to discuss ideas, it's safe to give feedback, and it's also very safe to learn from mistakes. And this assists us in the formation of a psychologically safe environment, which is so important. It also provides the exploration of our internal curiosity and allows us to ask questions respectfully. And I think when we provide our education sessions in our formal introduction, we make sure that everybody feels safe, and that we establish the boundaries of our conversation, that this is a safe environment for you to ask questions freely, and that we feel it's important to be able to have that safe conversation. The B in our rainbow, of course, has to stand for barriers. Like any project, there's many barriers. That doesn't allow the movement of our programme, and these barriers also include the time and resources. There's also our research experience, our experience in data analysis and interpretation. Most notable of all is the formal accreditation processes for our hospital systems, and that's what inspired Christine and I to reach out to the private sector for the Healthcare Awards. By winning our award in May, it validates the work that Christine and I have done to date, and that our education programme is necessary and contributes to the overall development of an equal, just, compassionate and progressive healthcare service in RUH and beyond. The O in the RUH rainbow is for the older person, and they put the silver in our rainbow. We have to be a little bit different in Roscommon. We have to add a bit of silver. The old person population accounts for the highest rate of attendance here for our medical day services, our outpatient and inpatient care within the confines of RUH. As a result, it is imperative that we recognise this cohort and that we support them. Legal and societal change has brought with it important and meaningful transformations, but there remains a huge interplay between the lived experience of the community and historical times. Ageing in Ireland brings with it several issues, that's be it facing the ageing cycle with the double invisibility, i.e. meaning that you're an older person and you are part of a minority grouping. These fears include being put back in the closet if they have access healthcare. It also means feeling stigma or being a forced feeling of otherness. You're not like everybody else. Or feeling a loss of agency if their health or their cognition starts to deteriorate. And feeling isolated and alone. Education and awareness training of these issues is paramount to eliminating some, if not all. And there are many barriers, some that I could list on forever. And it is worrying because it's an issue that happens to us all, not just from a gender minority, and it is very, very frightening. And that's why the project is committed to creating the safe and open and non-judgmental environment. And most importantly, the W in our rainbow is a welcome. We welcome all members of staff to attend our education sessions. It is not only the aim of our project to simply provide awareness and visibility, but it is to create a platform for the provision of advice and support and discussion of issues and concerns that occur when accessing healthcare. We've achieved so much in Ireland over the last 40 years, but irrespective of the change that has happened, healthcare is only as good as the education of the care provider. This means that it's imperative that we continue to create a more open and inclusive healthcare system through education and awareness training. There's a famous quote out there that says that we're not included until we're all included. And that will probably exist until the end of time because it is very, very true.
Christine and Michelle, it's been a pleasure listening to you. I want to say thanks and best of luck in the future with the continued work you're doing with your project.
Thank you, Cora.
Thank you very much.
Today's episode was produced by Miss Annette Cuddy, Director of the Centre for Nursing and Midwifery Education, Mayo Roscommon, Miss Mairéad Loftus, Specialist Coordinator Nurse Tutor in the CNME Mayo Roscommon, Mr. Alan Meaney, Radio Producer, And I'm Cora Appelbe, Specialist Coordinator Nurse Tutor in the CNME Mayo Roscommon. We look forward to welcoming you to our next episode, and you can follow us on X at CNME Mayo Ross